What's good, YouTube? This is Kai. It's been a minute since I did an upload. I think it's been since July, but a lot has occurred since July. Uh, I had my top surgery, so that was magnificent. Uh, and let me see, just all life in between. Things happen. So most of all, I was just getting prepared to go. Uh, let's see. As far as besides the top surgery, now since I've been off, I'm able to let my hair grow in. So I got more hair growing in on the side. I can actually see what will grow in. So I'm happy about that. I have more hair like under my chin and on the sides here, if you can see it. But my hair and my mustache doesn't grow as fast, but I'm sure it'll come. Uh, like I said, I had top surgery on August 30th, 2012, in Plano, Texas, with Dr. Peter Raphael. And I can't say, man, enough about them. They were excellent. They took their time with me as far as any questions I had, because I was, coming from another state, so I had to come in. I had to get all my blood work done before I went. Like between 1 and 2 weeks, I had to have my blood work in, mammogram, since I'm over 35, and I had to have my physician and my no, I'm sorry, I had to have uh, my psychologist to send a letter. He faxed it to him, and so I had to have that done 2 weeks before I went to Plano. Once I got there, in fact, let me tell you about this. A lot of people may have to fly out, they may have to drive. Well, my aunt went with me, my Aunt Sandra, the greatest aunt on earth. She went with me, my support, and we took the Megabus. I don't know if people have heard of Megabus, but I got my tickets. I got my tickets in June, and a round trip total for the both of us was $8. So, if you can, I don't know if they service everywhere. I know they service Chicago, Memphis, on the East Coast, places like that. But sorry about that. But it's an excellent way to travel. The bus is clean. It's a double-decker bus. You got Wi-Fi on it. They don't make a whole bunch of stops. We made like 2 stops, and it was 15 minutes tops. But that helped me out tremendously. Once we got there, we got a rental car from Enterprise. They came and picked us up from the bus stop, and then took us back there, and then of course we went on to the hotel. The bus took us to Dallas. We had to go to Plano, which is like maybe 30 minutes away, which was no big deal. And Dr. Peter Raphael have like in his packet that they sent me, they gave me like different hotels that suggestions that I could use, stay for, because I ended up staying like 9 days. And we chose the Fairfield Inn because they gave a medical rate, which was $75 a night. And the rooms were great, double beds, microwave, refrigerator. They cleaned the rooms every day. It was really, really nice. Plano was a great place. Everybody was nice. I thought I was in some kind of Twilight Zone or something. But I guess it should be that way, but everywhere is not like that. Dr. Peter Raphael, like I said, he was very, very personable. He had very good bedside manner. He answered any question I had. He took his time. You know how sometimes you can know the doctors and it just seemed like they're in a rush. He wasn't like that. Catherine Walker, his personal assistant or RN, she was excellent. She set up the patient consultations. That's who I talked to mostly until I met Dr. Raphael. And the nursing staff was great. They were nice. They took their time. Any questions you had, if they didn't know it, they'd find out for you. The facility was excellent. It was clean, modern, sleek, the doctor's office was in the same facility as the surgery center. So, you didn't have to find 2 different places, just one spot. You got everything done. So it was a very good experience for me. Very good experience. The surgery went well. I was in there maybe an hour and a half. My surgery was like at 10:30. I think I started waking up around 1:30. But my aunt said I was out about an hour and a half, 2 hours. And the great thing about his surgery is you don't have the drains. He does this quilting technique where he sews you up a certain way where you don't have to have the drains sticking out on your sides. So I didn't have to deal with that. Um, I stayed. I had to stay. I had to stay 7 days. A week after the surgery for my post-op checkup. Everything was good. They told me how to do the nipple dressings and how to take care of myself really after the fact. So took the bus home, and me and my aunt was back. And it was truly, you have it all in your head how it's going to be, but it was nothing like I thought. I was in no pain. I think I may have taken 2 pain pills, and only because I just did it because I didn't want to feel any pain after the surgery, the first day of surgery. Anesthesia, I got sick, but I usually get sick under anesthesia. So after that, I was cool. The first day, was the toughest, of course, but the second day and after that, I was fine. I mean, yeah, you need assistance, you have to take sponge baths and all that stuff, but you can expect that. But now I'm back home, and I can't help around here. We have 4 kids, me and my wife, and so that's kind of tough, just not to be able to help, but lay down with $6,500, so want to keep things intact. Let's see. I just want to just say again how good my aunt was. I mean, she is great. She helped me. It also helped that she's an RN. So, not that I needed that, but she really helped me out, while I was there, and took good care of me, and I really appreciate it. I love her to death. But yeah, I mean, it's looking good. My nipple grafts are looking good. In fact, let me just take a minute and show you. But everything is good. I have to keep these on. Well, they're going to fall off eventually. They're going to fall off. But I have to do special dressings for my nipples until they heal all the way. And everything looked good. I mean, I'm really, really, really happy with it. I mean, I couldn't imagine how it was going to look, and it turned out to be, in my eyes, perfect. So, there it is. But usually I keep it wrapped. I'm just letting it dry out because I just got out the shower. So I'm letting my steri strips dry out. And then I'm going to put the nipple dressings back on, and then I bandage myself with Ace Wrap. I have to do that for another 4 weeks. So, well, it said 4 to 6 weeks. So we'll see how it goes. But I'll probably do it to 6 weeks just to, be cautious. Like I said, you laying the money down, so why not? But now I'm just waiting around patiently so I can work out some of this fat I have. I mean, when they cut your chest off and you look down for the first time, it's a whole new perspective. I mean, I didn't know I had the type of gut. Hard to say, but hard to believe, but I didn't know. So I have some work to do when I can work out, but hey, I'll get it off. But yeah, I mean, now I'm really, really happy. I mean, I can't explain it. It's just a dream come true for me. And if anybody want to know anything, you can contact me. And like I said, they were very, very helpful. Anytime I needed to talk to them, if they didn't get back to me that day, they got back to me the next day. I mean, they were really good about answering any questions and being patient. Other than that, everything's good. I mean, I don't go back to work. Excuse me. I don't go back to work until the end of October. So I'll just be here chilling. All right. Until then.